Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, August 19th, 2025. And we got some new reviews out on negligent radiologists, Vulcan Imaging Associates. They are a Birmingham, Alabama based association of radiological medical doctors. The first one you can read on Google itself. Type in the name of the company as the search term and look on the right hand side of the page and click reviews. Looks like it went up in May of this year. It reads, "Funny, there seems to be a pattern here with this company and some misdirection when it comes to billing. For context, see my review on Russell Medical or don't waste your time. Avoid this business. When I called to inquire, they were just rude. My bill was only $126. I just wanted to understand as I was under the assumption I had already paid at the hospital." If you go to this customer and patient's review on Russell Medical, looks like they're talking about Russell Medical Center located in Alexander City, Alabama. This review reads, "Had a pulmonary CT scan performed here. I live in Birmingham, so I had called beforehand to clearly understand the pricing, as this is not covered under insurance. Some places will not perform this scan without a doctor's request. I was given a price over the phone, paid at the office, and had the procedure. I received an additional bill 3 months later for another $126 for them to read the scan. When I called to question it, they said it was a third party, and that is Vulcan Imaging, that sent the bill. It had nothing to do with them, and they were rude about it. Given the nature of the conversation, they must have a lot of miscommunication when it comes to billing." So yeah, very interesting. In this instance, it looks like we have a case of unstated or surprise billing or charges. And this is very disturbing. This may be in violation of standing law. If you only had to deal with Vulcan Imaging Associates and had a billing matter, you might have made off pretty good as a customer and patient, because what happened in my case is I was misdiagnosed and I almost died because their doctors told me that I had no injuries present, despite the fact that I did. Another assertion of unprofessional business practices. Yeah, my experience dealing with Vulcan Imaging Associates and reading about others' experience is they will do and say anything to get your money. And once they got it, they will not speak to you. Their tactics involve targeting affluent communities, subdivisions, neighborhoods around Birmingham, Alabama. They'll go into an area such as Mountain Brook or around the vicinity of the Greystone neighborhood up on Highway 280. They'll sponsor events in these areas. They're interested in clientele who have exemplary insurance, like a lot of corrupt doctors. Once they find security in well-paid insurance, they'll leech on Vulcan Imaging. They regularly reply to reviews and complaints, but the reality is this is simply a token or a procedural issue. Whenever you call the number or attempt to communicate with Vulcan Imaging Associates and the discussion starts to lean toward culpability, liability, or responsibility on the part of Vulcan Imaging and their doctors, as you'll hear in my own recorded call at the end of this video, they'll start making up lame excuses and eventually hang up on you. Here you'll read another assertion of the rudeness of the staff of Vulcan Imaging Associates. You can hear this in my call also. I don't put up with this stuff. I'll take these people to task in a discussion. If you deal with Vulcan Imaging's doctors like I did and I had no insurance, you basically get discarded, forgotten. Alright, so takeaways. When you have x-rays, MRIs, and CTs taken around Birmingham. You want to find out who the doctors are that did the analysis with the scans, who those doctors work with in terms of radiological organizations and groups. And if you had any kind of problems and you find out that a Vulcan Imaging Associates doctor was involved in your scan, you need to go on guard. Use discretion in prosecuting your own resolution in the matter. If that involves seeking out an attorney, feel free to share my videos with them so they know who and what they're dealing with. You need to be on maximum alert when dealing with these predators. I was a patient customer of a Vulcan Imaging Associates doctor, and I'll go into my own situation with what happened to me. I had an MRI of my head handled by Vulcan Imaging Associates and St. Vincent's in Trussville, now UAB, in 2019. In my own scan, I was told I had no injuries. I knew better because I was close to death. Almost died from this. Went and got those pictures. I'll put the pictures up here in this video. As you can see in this MRI, I've got about 6 inches diameter infection inside my head. Vulcan Imaging Associates neuroradiological specialist Dr. Michael Brant Ruff, MD, went to school for 10 years to do his job. And he wrote in my records and report, which you can see in this video also, I scanned these in. He said I had no injury present. And so this created a very uncomfortable situation that has yet to be resolved and is outstanding as of this recording, April 4th, 2025. Took these issues to basically all concerned, and they all refused to correct their error, admit their mistake, do a reread. Oh yeah, and they sent me a bill for this MRI, and it was somewhere north of $600. Interestingly, Vulcan was working with St. Vincent's Ascension, who did the scan for me. On November 1st, 2024, Ascension sold this location and 5 other hospitals to University of Alabama at Birmingham, and this whole system has been rebranded UAB St. Vincent's. Why did Ascension sell and leave the area? My story is definitely something that the public needs to be aware of, because the practices that were allowed to occur in the St. Vincent's hospitals and medical facilities were probably enough to shut this place down. Just a personal perspective, my injury and all the complications, my own issue is worth several $million. Alright, so today we're trying to follow up on the Michael Brant Ruff MRI that I had done in 2019. I was referred to this scan by Northside Medical Associates, nurse James Frankie Crum. This is now Complete Health, owned by Pharaoh's Capital. This is located off of Happy Hollow Road, Trussville, Alabama, headquarters in Pell City. Michael Brant Ruff is a doctor who read the MRI for St. Vincent's Ambulatory Healthcare Network, LLC. That's Ascension. If you're following my documentation, you'll note here that in Birmingham, Alabama, we got a real big problem with responsibility, accountability, and radiology. And this week I talked to the 2 main radiology companies in Birmingham, Alabama. And I recently spoke with Doyle Stewart, CEO of Birmingham Radiological Group. According to their website, they have 38 radiologists who work with them. And here in this call, you'll hear me speaking with Kim Mooney. She is the administrative coordinator at Vulcan Imaging Associates. And she states that they have 37 radiologists who work with them. So if you got radiology issues, you go into a medical practice or hospital, doctor, you have an x-ray, MRI, CT scan, these are the types of doctors, and these may be the actual doctors who will be looking at your scan in the Birmingham area. And yeah, according to my findings here, not very reassuring, If your scan is misread, you discover this and you try to seek a redress on these misdiagnosis issues. Not encouraging, my experience here.
You have reached Vulcan Imaging. Vulcan Imaging, this is Kim.
Yes, ma'am. I called last week. I was trying to get in touch with one of your radiologists, Dr. Michael Brant Ruff. I had an MRI scan that was looked at by this doctor in 2019. I got a report with his signature on it saying I don't have injuries. However, in the MRI images themselves, I have evidence of a very serious head trauma-based injury. And yeah, I was told last week that you guys would try to have this doctor get in touch with me, so it's been about a week, and I just wanted to see what the status of that was.
Okay, so I did look into this, and based on, there's not anything else we can do, so there's not anything that Dr. Ruff can do to assist you with that, since the report's already been read. So there's not anything we can do.
Well, I beg to differ. This was a $700 MRI scan. This doctor was paid to have this scan looked at, and he did not note the injuries. So he is at fault. And so is Vulcan Imaging.
We stand by that report 100%.
Okay, well, the report is in error 100%, ma'am. Can I speak to somebody in management?
Yes, sir. I am the practice administrator.
Okay, can I speak to the head of the company?
Let's see.
Who's above you?
The chairman of the board.
Okay, well, I need to speak to somebody in authority because you're in error with your statement, ma'am. Not professional.
I am so sorry you feel that way, but we stand.
Well, it's not how I feel. It's the facts, ma'am.
Well, now, what you're stating, we would respond. Maybe you consulted an attorney to have.
Well, if I can't speak to somebody on the telephone about this, I'd be happy to come clear it up in person.
You're more than welcome to come up here and talk to whoever you need to talk to.
Because this is a serious issue.
I understand that from your perspective.
Yeah, your excuses aren't going to cut it either, ma'am.
It's not an excuse, sir. I really don't know how to help.
What you should do is, you're in business, all right? Well, you have doctors who went to school for 10 years. They're millionaires, okay? They're reading radiology reports for hospitals and other doctors, okay? What you need to do is you need to have them do their job correctly. And if they miss major injuries in patients that they almost died from, such as myself, you need to simply make an attempt to correct this error. Now, I could get in touch with Dr. Michael Brant Ruff. I could supply my records. He could look at these images again, and we could clear this up in a few minutes. Could I please talk to him?
No, sir. I can't reach out to Dr. Ruff. We don't consult with patients.
That's a very sorry excuse, ma'am.
I'm so sorry. That's our policy. Let's see. What can I do to help you? Let's see. Eric Blackman is my CEO.
Well, why are you mentioning his name? Why don't you just connect me to him?
He's not in the office.
Oh, that's pretty convenient, huh?
Well, it's the truth.
Well, I don't believe you.
I'm so sorry about that.
Yeah, me too.
Let's see. What I can do is I can give you. Let's see. His direct number is.
How many radiologists work for your company, ma'am?
I have 37.
So you have 37. Why don't you take this scan, call somebody right now, and have them look at this scan and correct this issue for me?
But that is not how radiology works. We can.
Yeah, you're not professional. We've already established that.